Envision Healthcare just went public this morning. They priced at $23 at the high end of the range. The stock is doing very well on its first day of trading. Joining me is the CEO, Bill Sanger. So let's talk about your business if people aren't familiar with you. You have a large market share in the ambulatory area, staffing ambulances and also staffing ER rooms. Let's talk about that market share, how you got there and how you intend to grow it.
Sure, thank you, and good morning. If you look at our market share, we're in three distinct aspects of healthcare. Pre-hospital care, that's our ambulance side of the business. Hospital care, and what we do is not only manage the emergency department, but many of the hospital-based physician service departments, including anesthesia, surgery, and a new specialty called hospitalist. So we're on the pre-hospital side, the hospital side, and we now have created what we refer to as a post-discharge or post-acute care environment where we actually care for patients in nursing homes, skilled facilities, and also in what we call the medical home. So it's a very unique value proposition where we're actually following the patient across the whole continuum of care.
Well, you bring up a good point about value because obviously it's an expensive area for many cities and states. Are you seeing any issues with municipalities not having the money to maybe have their first responders? Are there first responders there trying to hold on to that business? Or are you seeing them, wanting to maybe outsource it to save money?
Yeah, if you look at what we do for municipalities, communities, townships, it's really related to the AMR business, the ambulance business. And we are a cost solution provider, for many communities. Generally, most transportations, medical transportations in this country are performed by the fire department. The fire department is supported by a tax base. We can come in more often than not and provide a lower cost solution, and frankly, our outcomes are better. Our patient survival rates are better.
I also wanted to ask you about a trend that we've seen, not so much here in the Northeast, but in other states where you're seeing what we call a doc in a box. It's like a standalone ER type of service or a standalone specialty hospital. Is that helping you, or do you find that more competition?
Well, clearly, if you talk about the doc in the box, the minute clinics, the take cares, and now there seems to be a proliferation of actually freestanding emergency departments. They have actually met an unmet need. Many times you need to see a doctor, they're not available, and your options are to go to an expensive emergency room. And so the freestanding urgent care centers, as you refer to the doc in a box, really are a very good solution, to caring for the lower acuity patient at a lower cost.
Also, now we've got so many big changes coming up with healthcare, with the exchange coming up. Is that going to help you or hurt you?
Well, we think clearly we're going to have tailwinds as it relates to healthcare reform. If you think about in this country, there's over 25 million uninsured. The whole uncertainty of the 11 million illegal aliens in the country, what are they going to do accessing healthcare? As we move towards some form of reimbursement for those that presently have no means of payment, we do believe it'll be beneficial to us. Last year, we cared for over 13 million patients. 2 million of those patients had no ability to pay for that service, and so we absorbed that cost. So if we have some means of reimbursement, then that would be beneficial for our company.
I bet it would be. I can imagine more paying customers better than non-paying customers. What's your big plan for this year? What's your big goal?
Our big goal is to continue to perform. We're a growth company. It's all about the patient care, and we're excited that we now can follow a patient from the time they enter into the healthcare system, be it an ambulance, an emergency room, or even a doctor's office, all the way through the care to the home. So we're very excited about that. Our 26,000 employees are all excited about this new continuum of care we have. Our new name reflects the fact that we are caring for patients pre and post care, and that's what our focus is going to be.
All right, well, it sounds like the stock is just what the doctor ordered today in the market because Envision Healthcare priced at $23 at the high end of the range. That's CEO Bill Sanger, and I'm Deborah Borchardt with The Street.